Type 2 diabetes doesn't appear overnight. It usually develops slowly, and the early signs can be so mild that many people overlook them. But the sooner you recognize these warning signals, the sooner you can take action and protect your long-term health. Frequent urination. When blood sugar levels are high, the kidneys work harder to filter out the excess glucose. This makes people urinate more often, especially at night. If you find yourself waking up several times to go to the bathroom, it can be one of the first red flags. Constant thirst. All that extra urination also pulls water out of your body. As a result, you may feel unusually thirsty no matter how much you drink. Persistent thirst and frequent urination often appear together in the early stages of diabetes. Increased hunger. Even after eating, people with type 2 diabetes may feel hungry again quickly. Why? Because glucose from food doesn't move properly into the cells to provide energy. The body keeps signaling, "I need more fuel," which creates constant cravings, often for high-carb foods. Ongoing fatigue. When your cells can't access the energy they need, you may feel drained and tired all day long. This kind of fatigue doesn't go away after a good night's sleep. It's a deeper lack of energy caused by high blood sugar. Blurry vision. Excess sugar in the blood can damage tiny blood vessels in the eyes and also cause the lens to swell. The result is blurred or fluctuating vision. While this can improve when blood sugar is controlled, untreated diabetes may eventually cause permanent eye damage. Slow healing of wounds. High blood sugar damages both nerves and blood vessels. Circulation worsens, and even small cuts or scrapes can take weeks to heal. This slow healing also raises the risk of infections. Tingling or numbness in hands and feet. Nerve damage, called diabetic neuropathy, often begins in the extremities. Tingling, burning, numbness, or pain in the hands and feet may develop gradually. Over time, this can progress if blood sugar remains uncontrolled. Darkened skin patches. Some people develop darker, velvety patches of skin around the neck, armpits, or groin. This condition, called acanthosis nigricans, is strongly linked to insulin resistance, one of the earliest steps toward diabetes. Itching and frequent yeast infections. Excess glucose in the blood and urine provides food for yeast. This often leads to recurring infections in warm, moist areas of the body, such as the mouth, armpits, and genital areas. Symptoms may include itching, burning, or discomfort. Why these signs matter. These symptoms don't always mean diabetes, but together they are a warning. Without treatment, high blood sugar gradually damages the heart, blood vessels, kidneys, eyes, and nerves. Over years, it can lead to heart attacks, strokes, kidney failure, vision loss, and foot problems. Early diagnosis and treatment, combined with healthy lifestyle changes, can prevent many of these complications. Who is at higher risk? Anyone can develop type 2 diabetes, but certain factors increase the risk. Age over 45. As we grow older, insulin sensitivity decreases, making blood sugar harder to control. Excess weight and inactivity. Belly fat in particular raises insulin resistance, while lack of movement prevents the body from using glucose efficiently. Family history. If your parents or siblings have type 2 diabetes, your chances are higher. Women with PCOS or gestational diabetes. Hormonal imbalances and diabetes during pregnancy increase the risk later in life. Cardiovascular disease. High blood pressure, high cholesterol, or a history of heart problems often go hand in hand with glucose issues. Conclusion. The good news is that type 2 diabetes can often be delayed or even prevented with timely action. If you notice several of these early warning signs, talk to your doctor and get tested. Blood sugar tests are simple, and lifestyle changes such as balanced eating, regular activity and weight management can make a huge difference. The earlier you act, the better your chances of staying healthy, active, and free from complications. Take care of your health. It's the best investment you can make.